So, good evening, friends. I'm Dr. Venkatesh, consultant urologist and renal transplant surgeon, Kaveri Hospital, Hosur. And I'm also your DocTutorials and Team RRM Next urology faculty. So, I'm very happy to share that in the last November 25 INI SS Urology session, out of 10 rankers, 9 of them were directly from our own platform, and all of our students. And most of the students have cracked through this session. So, as a faculty, and a teacher, I'm very very happy to hear these news. So these are the days we actually really love, like when our students call back after the exams and saying that I've joined here, I've been cracked through. So those were the real days which actually motivate us to take us this teaching program further, despite all the hectic clinical work we have here. So I'm very happy to invite Dr. Prateek here. So welcome, Dr. Prateek. So you have secured an amazing rank of AML and CML 9 in this last session of November 25 urology. So first of all, many congratulations. So what you have done is something amazing. But what many would not have known about you is because I know how Dr. Pratik has been hardworking. He had been qualified for last three sessions, and he was having very near misses in the last couple of sessions. So I know how much difficulty he have undergone. So this is especially for for those students like who got qualified, who even went to interview but could not get through a rank. So this is always a story of perseverance. So on here in front of us we have Dr. Pratik here, who is the right person to share his experiences. So first of all, many congratulations, Pratik. As I already said, I'm more than happy, and I'm also equally relieved that you finally cracked through the last hurdle. So please introduce yourself, Pratik. Where are you from, and where did you do your undergraduate, post graduation? And from then we'll take your journey through.
First of all, sir, thank you, sir. Thank you so much. And actually, these are actually this moment is bringing me goosebumps. Sir. This I actually wanted this to be happening 1.5 year before, and this is happening ultimately after a gap of 1.5 years. It was really a very tough journey. I always wanted to sit in front of you, introduce myself. Like I used to watch the videos of every candidate sitting in front of you and describing his or her story. And thank you, sir. I really owe you, and thank you so much. And now, sir, actually, I am Dr. Prateek. I did my MBBS from Adesh Medical College, Bathinda. I am basically from Punjab, sir. And I did my post graduation from DMC Ludhiana, and I did it in the year 2022, sir. And afterwards, I joined as a senior resident in the same institute only. I worked there for a period of 1 year. I strengthened my surgical skills. I actually, at that point of time, it was not in my mind that I have to go for laparoscopy. I was quite good at laparoscopy at that time. So I decided that I'll be settling with this general surgery as well as some part of this laparoscopy only. And that's why after a period of 1 year, I joined as a consultant in actually I joined as a consultant in a hospital, corporate hospital. And there's actually I was a youngest of all those people, and they were all they were all MCH and DM people, and they actually boosted me up, sir, that you are a youngster, that you have to go for MCH, and why you are settling with this MS? You have a very young age. You are a very young age. You have a very young age. You have to go for it. So, sir, that time I decided to prepare, and from then on, sir, I started my preparation. And
Okay,
someone,
just a
one
minute.
of
I'll
my
just take a call. I'll just take a
sure,
call.
sure.
Just a minute. Hello. Hello,
Yes, sir.
Karthik. Oh, okay. I'm extremely sorry. I just had a call
No,
from the
no issues.
hospital. I'm sorry on that. Oh, so please continue. I'm really sorry, Pratik, to stop
No
this
issues, sir.
interview because I had to take this call. I'm sorry on that. Okay, please continue with your journey, Pratik.
Sir, so then actually I started my preparation. I left that corporate hospital and then I joined a PIMS Medical College Jalandhar as a faculty member, sir, as assistant professor there. And I was working there since then, and I was doing my preparation also. I was doing my OTs also, and everything was going side by side, sir. So this happened about 1.5 years. Since 1.5 years, this is happening, sir. And this was my third attempt, sir. Ultimately, I went through it.
That's good. That's good. So you've been very perseverant in last 1.5 years. So that is what most of the students falter through. They give an attempt, and obviously they most may not be. Once they just didn't go through, or they feel okay, it is not to my thing. INS is not something easy for me to crack, and they just leave out. So people have to understand that it's a process. Okay, so you have to find there is no absolutely no necessity to take a break or something like that. So just before you, I interviewed a guy who Aditya Kevin. He was secured rank three, and he was also not a fresher. He has finished a couple of years back. He has taken a break and he worked in KMC as a professor. So these two are very important points. So there's absolutely no pressure at all. You can continue doing work, you can continue taking care of your family, and simultaneously you can work on that. So all you need is to have a put in a constant effort, and you have to be very perseverant in it, and you have to be very passionate on what you look for. So that's so great, Pratik. So what made your interest in urology, and how did you get into the DocTutorials platform? So just tell on that. Is it through word of mouth, or how did you get to know that we have a platform and we are training the urology residency for students to go through INISS?
Sir, I want to tell you here that after leaving my PG institute and after doing my SRship, I was not aware of any platform. I actually, it was like I don't have to go for MCH. I was settling with this MS only. And that time, sir, when my seniors boosted me up, then I decided that I have to prepare. But now, where to prepare, from where to prepare, and also which branch I have to opt for, that was my actually a question. And so during my PG days, what I saw was that urology patients were a huge number of patients are there, sir. And like being from North India, being from Punjab, I see maximum number of patients are of Euro, may it be stone diseases or may it be malignancies. And also, sir, what I believe is like you being this being MS, I was already doing GI, may it be GB or appendix, I was already doing it. So then, sir, in that hospital, in that private hospital, I actually assisted my colleague there for a few cases. And then, sir, actually, I realized that this branch can be chosen. This is a good branch also, and obviously, the number of patients are also more, and also have to settle in this my city only, my Punjab only. So I think I have to give a try. I have to at least start reading this. And then, sir, my senior, he actually advised me that. Actually, I asked him that I have to go for MCH, and I am deciding that I have to start the preparation for MCH Euro. And he was already working on that, and he actually guided me that DocTutorials is actually a good platform, and you should join it once. You actually start actually doing the videos at least, so that you can get an idea whether you have to go for this branch also or not. So, sir, actually, I logged in from his ID only. I wasn't. It was not mine initially. I logged in from his ID. I started watching your videos. Then, sir, it built my interest. It built the core, and then, sir, I purchased this app, and from then on, sir, I'm doing everything from this app only, sir.
So, okay, so that's nice. Like, so have you? I ask one more question to most of my
Yeah.
students. Have you been reading through the textbook of Campbell, or how did you? What were your source materials for all your preparation in last 1.5 years? I think you have given. This is your third session. Okay,
Yes,
so
sir.
what were your base materials, and how did you been working on it, Pratik?
Sir, I want to tell here, I think I want to clarify here everything, sir, because I think this video should be useful to the people who have not cleared actually. this time.
So
I want.
that is the whole purpose. See, this
Yes, sir.
interview is it is actually have a couple of purposes. First of all, it's a deserving accreditation or credit to all you toppers, because you guys deserve this moment, because you have put in sacrifice a lot of efforts and your family time behind this, and you guys thoroughly deserve this. This is our a small attempt from our end to appreciate all your efforts. You guys definitely deserve this. And next thing is, each student has got a different story, different background. See, I don't know, I have interviewed almost close to about 40, 50 students in last couple of years. I think most of the interviews, even you would have seen it. Even
Yeah.
with every student, I tend to get one small point or a source of inspiration. So how much difficult those guys went through, how much of desperation some of those guys. On the other end, there are students who just crack through just even before finishing their MS as well. Okay, so I have seen the travel of wide spectrum of students cracking through. So, and definitely your story will be more inspiring, because you had very near misses in last couple of sessions and you didn't still lose hope, and you are still continued working. You never taken a break. So definitely, I'm for sure, Pratik, your story will be an inspiration for a lot of juniors who's going to watch this. So
Yes, sir.
please go through that. Like, please tell us your journey through that.
Yes, sir. So then, sir, 1.5 years back, sir, I started my preparation for Euro. I purchased this app of DocTutorials, and this was my base actually, sir. I purchased the Euro also in the surgery part also, and everything I watched, all the videos, every video I watched, sir. And urology, I watched some videos, I watched twice, sir. And like CA and CA prostate, CA RCC, everything I watched it twice, sir. And that was actually my base. I made all my notes with my own writing, sir. Uh, I didn't copy it from anything. I purchased my own notes. I actually wrote my own notes with different pen colors. So like the most important point to be noted with the red color, simple basic thing, the concepts to be noted with the blue color. Everything I did from this app only, sir. And then now, sir, when actually it built my trust in this app, and also it built my core also, then I started solving the MCQs exclusively initially from this app only, sir. And at that time, sir, actually, like, I am appearing for the third time, sir. I will also tell you what went wrong the first two times as well. So
Yeah.
actually, sir, like, my Euro, when I used to give that test, Euro was actually my actually, sir, you are the gem. You are gem in Euro. You teach us the way actually we wanted, because we are not aware of urology. We have in during my PG, and every person, he or she actually focuses on the GI part only during the MS. So he is not aware of the super specialty like urology. It is actually new to us. So to build a core, to build the concepts, what actually is Euro, you teach us that way, sir. You are actually a gem. Your notes are just gold. So when you read it, actually when you read it, then you understand ki, okay, these are the concepts. This way I have to proceed. Then, sir, I started solving your MCQs, DocTutorials MCQs. I started solving. One thing is for sure, sir, the one who has read your notes and solved at 1541 questions, and at least even once, then, sir, definitely he is going to be in that stage 2 departmental assessment. He is appearing for the interview, that is for sure. May it be any it may be a tough paper, may it be an easy paper, he or she is appearing in that interview session for sure. I'm not saying that rank will come, because surgery is also included, sir. But yes, he will be there in the interview. Now, the second problem is the second thing is that in out of these 80 questions, 30 questions are from surgery, and some people actually ignore that. Like, they are focused more on Euro or more on some specialty. They actually ignore that 30 question ki, haan, ye to aata hi hai. They used to think like, we know this thing, so we can proceed in that way also. But it is not actually like that, sir. Actually, surgery is quite easy. Every time they ask very easy surgery basic things they ask. But that basic also, if someone hasn't read, then you can't answer it. I think out of 30 questions, if the correct responses are more than 25 in that the surgery only, then remaining your Euro is also good. Then only you can get through, sir. I was checking the questions after my the first attempt also, the second attempt also. Euro was going good, but the general aspect was going weak, sir. It was, I think, my in the first attempt, like, around 18 or 20 questions were correct, and second attempt also, sir, similar questions were correct. So that's what I realized. I actually discussed with some my senior also, Dr. Dr. Akib from Jodhpur. He actually advised me that you focus on these areas. You read Sebastian, you read tables, you read Bailey, and apart from the notes, you read these all these stuff. This will actually fetch you marks, and that actually made me realize that this was a lacking thing, which I could have done earlier also. Because after the first attempt, it was in my like it was I was very confident that yes, I'm going into it. I'm going to AIMS PGI, that is for sure. Because but when the rank came, rank was 36. So another thing is that some people say that competition is comparatively less here. That is true, sir. That is a fact. Competition is less. But if the competition is less, the number of seats are also lesser. Appearing
Yeah, that's
candidates
true.
may be less, but the seats are also less. So like this time, 26 seats are there. So you have to be in top 26. If you are ranked 29, that doesn't mean you haven't studied. You are a great person. Obviously, you have studied well. You have studied Euro. Obviously, you are among the top 29 students of the India in appearing for Euro. But that 29 rank will not fetch you seats, sir. That should be kept in mind. So that actually, sir, after first attempt, that actually made me realize that 36 rank is good. My family, everybody was happy. Yes, you got into this 36 All India. But the thing was, with 36, I was not getting the seat ultimately. So that should be kept in mind. And I think that was the reason. And most people quit also after first attempt or second attempt. They quit. They say, yeah, this is difficult. AIMS, agar AIMS nikalna hai, to you should be from AIMS only. Some people think like that, but it is not like that, sir. You have to be focused. You have to build courage. Like I was appearing for the third time, sir. I was in touch with you since 1.5 years, sir. I was continuously messaging you. May it be my personal issue, or may it be, sir, related to study also. I was messaging you. I was continuously in touch with you. I know, sir, how it went, how 1.5 years went. Obviously, my colleagues and my family, they were all support pillars, that is for sure. But actually, it was me who was feeling that rank one, rank first time 36, second time 42. Again, you're not getting into MCH, and this time now, I was at a point actually that I can't go back also, sir, because I wanted to pursue MCH, and I was not getting ahead also, sir. So that was actually striking again and again. I was actually, I was very at that time very difficult for me at that point of time. So, but still, sir, I kept through. I focused more on the general surgery this time. That was the main thing. And what I believe is, like, out of 30 questions, what I believe is, I think my 28 questions are correct, sir. Because immediately after the exam, I recalled all the questions, 30 on 30 of general surgery, and I think 49 of Euro. I recalled all, and I messaged you at that point of time only, said that I have recalled, and you boosted me up. Yeah, you are getting into AIMS this time, because obviously,
Yeah.
sir, that was actually more motivation which I needed, sir. That is the thing.
No, because I could see the efforts you have put in, right? So
Yes, sir.
I have seen, see, all those, there's a saying without, the hard work never fails and perseverance will definitely take you through what you aspire for. Okay.
Yes,
So
yes,
I have gone through the tough process, and I now, even after becoming a faculty, now I've been in touch with a lot of students like you, not just you, I can tell n number of students who have gone through in the second attempt and third attempt, because it's, see, this is a relative exam. Okay, it's not that it's you fail through you come out with very good ranks. You had a you secured a rank of 30, but if the total number of seats is only 12, then what can you do?
yes.
That it is not.
What can I do?
That's
Yes,
what.
that's true.
Yeah, yeah, because here there is no point in qualifying. You have to top the exam. So that is the difficult part. So of
That's
course, there is an uncertainty of this departmental assessment, which
yeah,
I personally don't feel the right way to choose. There should be a simple, objective based, question based thing taking away this departmental assessment. But these are things which is beyond our control. But again, see, you've been knocking the doors of AIMS for so many years. So this time they could not deny you. Okay, that's what I used to tell. Like,
yes,
first time maybe they can ignore you despite you, but you keep on scoring extremely very good marks in theory. You've been clear, continuously been qualified. Then at some point of they have to give way to perseverant students like you.
yes,
So I'm really, really happy to have you, Pratik. So
yes,
anything to any one small piece of advice before we wind up, like, so especially for those who would have felt bad, like, okay, I gave the exam, I qualified, but I was not called for an interview. Am I taking the right decision to go for the INI SS preparation, or shall I just go for NEET SS where the pattern is easy, it's only general surgery based? So what is your piece of advice to many of the students? Because this is the nagging question to more than thousands of students who've been preparing now. Okay,
Yes, sir.
so in front of us we have Dr. Prateek, who has gone through all these turmoils and difficulties in last 2 years, and now he stands in front of us being successful and cracked through the exam. So I think you will be the very apt person to answer this question, Dr. Prateek.
Sir, actually, I want to advise here that first thing, every candidate should be very well. He should be actually aware that whether he wants to pursue this INI institute of Central Institute or not. First thing is that should be clear in the mind, whether you want to go for AIMS, PGI, or JIPMER or not. And I think I would especially actually I want to focus on those people who are non-Amazonians and they are not from the Central Institute. They have not done their MS or MBBS from the Central Institute. I want to actually focus on those people because I was one of them. And I want to tell you that first thing should be that whether you want to pursue your MCH from these institutes or not. And okay, so then if you want to pursue, you want to study, you want to work there, then a clear cut, crystal clear cut dedication and hard work is required, sir. There is no other way around for this. You need a hard work, and that you have to do. You have to work hard. You have to study, and it's not about how much number of hours you have to study. It's about the quality of the actually the quality with which you are studying. That is more important, not the quantity. It's the quality which you have to study. And when you keep on studying, you're focusing, you are building your core, then you're solving your MCQs, everything you are doing, and then you are going into stage one. Suppose you clear that stage one, you're staging, then you are called for stage two. Now you're called for stage two. One thing should be clear in the mind that departmental assessment is not in our hands, sir. You study a lot, you study full on, you study, but still it's not in our hands, because this is something which we lack, I think. And these are the people I am actually talking of, non-Amazonian people. So these actually we lack in these things. And and then what is in our hands is theory part. So if you have secured more marks in theory, you have secured more than 75-80% marks in theory, then you are called for departmental assessment. Suppose somehow your number of marks are less in the departmental assessment also, that will compensate. Because if that will compensate, then again you are in top 5 or top 10, that is for sure. So what is in our hands is theory. If you focus more on theory, then definitely you are going to crack it. And must advise here that this euro you teach well, that is great, sir. And apart from this, I would advise that you, for the general surgery, you should go for that previous year questions which are mentioned here in this app also, and even euro also, previous year stuff which you have actually, sir, the videos are there of yours, and everybody should watch it. And then that people will be aware that what are the key areas in which they are asking. So once you are aware of it, and what is the standard, very easy and standard paper is this INI is very easy, all of concepts, basic concepts, no learning, no cramming. You read it once, you understand the concept, you can answer, no need to revise it again. This is my understanding.
No,
And so
you tell the very right point. I also tell preparing for INS is very easy. There is no
yes, sir.
need to cram all the small nonsense stuff or facts. These are concept based questions. Once you get a grasp of concepts, you can easily answer. So it may look at the outset for those who have not just gone through the basics of things, it will look like a very difficult question, very difficult paper. But it is a very simple and very standard paper. Year and year, every session, the papers are going to be very standard. The questions where they're going to focus is going to be same. Maybe the questions are going to be different, but it is very, very simple, provided you have a very solid platform in your preparation. So I
Yes,
think
sir.
it's good you brought this point, Pratik. That's nice.
So, sir,
So once
once
you
the previous year questions are focused, once the topics you know, then you can study and strengthen that topics, and again solving the MCQs, and you can buy the MCQ bank, you can study, and then again you can repeat. You will actually come to know okay, what are the key areas in which you need to focus. And then, sir, you have to do the grand test as well. I did all the grand test of DocTutorials. I never missed even a one grand test. Sir, 1541 questions MCQ. I remember that also. I finished it twice. I think yes, I finished it twice, sir. And that actually ends also, sir. This time few questions were from the MCQ bank itself. And So with that keeping that in mind, you know what are the key areas. So when you answer the question, actually, so this whole thing was advised by my senior, Dr. Akib. He actually told me everything. You should go like this. And so when you have finished, and then when you're doing the grand
Is
test also, so
is it Akib Patel? Akib Patel?
yes, sir.
I think he is also one of our students. I think
Yeah, yeah. So yes, yes, sir. So he
he
actually
is
advised me,
very
sir,
good.
and then he told me that you have to. The time is very important. Second point is time, sir. Time management is ultra important in MCQ exam. I finished my exam in 43 minutes. First go, I finished 43 minutes. I finished all 80 on 80 questions, sir. So this time management is important. How I finished in these 43 minutes? Just because I have done enough of the grand test. That was the main thing. So when I finished it on the first go, I finished 80 questions in 43 minutes. In the second, and some questions I bookmarked, sir. In the second go, I was still having a lot of time, and then I wasted the questions again. Then I corrected, many of the questions were corrected in that sense, sir. So I think time management is also important in MCQ, and that is to be gained only when you have given enough of the grand test.
Grand
And
test.
lastly, I would say that, like, if like it's like from my point of view, like I was appearing for the third time, and then third time I cracked this. So if, and I was dedicated enough, and I had enough of courage to again get up and again start doing the preparation. So I must say that if you have that courage, if you have that dedication, and if you are quite dedicated for this INI Central Institute, then doesn't matter from where your MS was, may it be private college, may it be paid college, any college. But if you're dedicated enough, then definitely you're going to crack it. But courage should be there in yourself, and dedication, strong dedication should be there. So then only one can crack it. Otherwise, no doubt competition is less, but seats are also less. Again, you'll end up with 20, 30, 40 ranks. Then again, sir, that will be quite depressing. So one should have a courage for that, sir.
So it's very happy to hear from you, Pratik. So I wish you all the very best for your career as well as your future as well. So of course we are going to be in touch. You can always be in touch with me anytime for sure. So thank you so much for sharing your insights. I think it is going to be of immense help to all the juniors and your friends in the future as well. Thank you so much, Pratik. Good night.
Thank you, sir. Thank you, sir. Thanks a lot, sir. Thank you.
Thank you.